Welcome to Healthcare Ops Wave. It's not only an acronym for how, but also healthcare operations and waves are actually very similar. Both are steady, run in cycles, and have the odd storm in between. I'm Frederik Mueller. I'm the co-founder and CEO of Third Way Health, and we'll bring you the stories that shed an inside look on the humans behind healthcare operations.
All right. Welcome to our next episode of the Healthcare Ops Wave. Leslie, how are you? Thank you for joining us.
Thanks, Frederik. Thanks for having me.
First podcast, right?
Yes, first podcast.
Yes. You are not the only one.
I listened to them, but I have not been on one.
No, I'm very excited for this because I think you have a really cool story to tell, and I'm sure that it's going to be great. So, well, look, a little bit about our podcast also, Leslie. I think what we're trying to do is bring healthcare operators to life, right? It's fun. Every day is a fun day when you work in healthcare operations. And we want to kind of highlight what people have done and also show other operators what someone like you has learned in growing ultimately a practice like Tribeca Pediatrics from 3 locations to where you guys are today, right? Can you just formally introduce yourself? What's your role now and what's your title?
Yeah, no, absolutely. My name's Leslie Pennypacker. I'm the Executive Director of Tribeca Pediatrics, which is a very large primary care pediatric office in New York City and essentially around the bedroom communities of New York City. So North Jersey, Westchester, and now we have an office in Long Island.
And at some point, you guys were even in LA.
We were in LA, yes.
Yeah. So I think that's such a cool story, right? And I think this is what there was something about in the New York Times where it said you went from bartender to leading a medical practice. So,
yeah, that's true.
How did you end up in healthcare?
All right, so my journey to healthcare has been a little bit unorthodox. So I've been basically at Tribeca Pediatrics for 17 years now. So basically that is my healthcare experience is Tribeca. I met Michelle Cohen when I was in college. I worked at a restaurant across the street from his first practice when he only had one practice in his house. So he would come in there a lot. And I was going to college. He had always had families coming in. It was great. He started a mommy group that would like have lunch in the restaurant. So it was really cool. It was very neighborhood. But from there, I went to graduate school. So I started graduate school in urban planning and was really interested in urban planning. I love New York City and history and all that good stuff. But then I got pregnant with my daughter and I needed to figure out something had to give. So I ended up dropping out of school for urban planning, dropping out of my graduate school. And Michelle asked me, at that point I was bartending and I needed a career because I was going to have a kid. And Michelle asked me if I wanted to work with him and manage his practice, which was completely crazy because I didn't really have any experience doing that. So I started working with him, and knowing Michelle, he takes a lot of risks. And I don't even know if he thought it was going to work out. But it did. So I started working with him. I think because of my inexperience, I worked that much harder in trying to understand everything. I worked in each of the front desk. I understood. I got to learn, bookkeeping and billing and all these little facets of the healthcare industry when the office was really small. Scheduling and creating schedules. And I learned all kinds of things about pediatric healthcare and primary care. Insurance, which was a whole new thing. So from there, that was really how I got into it. And I'm still here today. And I think I was really fortunate that he gave me a chance. And Michelle just he's a pretty inspiring guy. He just lets you figure it out. You have to figure it out or, there's really no other choice. So from there, we started kind of opening some new offices, a couple of years later. And I think that was really my favorite part, being that I did have sort of a background, or I initially wanted to do urban planning, that we would open these offices in these small offices in these neighborhoods, and they're really accessible on the street level for families, and people could come in, and it had this really sort of Jane Jacobs feel of being like a neighborhood office, a community office where people who live there could go to their office, and it was a beautiful office and they knew their doctor. And I think that was, that's really one of my favorite parts about Tribeca and building Tribeca. That's what excites me.
Wow. All right, we're gonna dive. There's lots to unpack here. Was there ever a falling in love moment with healthcare where you're like, I like this and I want to be doing this for the next 17 years?
Yeah, no, I think that healthcare and the service industry are very close. And I think that if more people look at healthcare like the service industry, where you're taking care of people and you want to figure out how to make things easier for people, of course, it's different serving a drink or, taking care of somebody's child. Absolutely different. But in terms of like, how can we make things a little easier for somebody and a better experience and smile and be happy to see them? I think that they're very similar in that respect. I also think that I get to work in pediatrics. It's just like such a lovely thing to do. People with their children and their families, and you come into the office and there's like 4 scooters parked there. That's really cool. Pediatricians are some of the coolest people to work with. They're such nice people. They got into medicine because they love kids. It's just really nice to be around that. It's a lot of working mothers, like pediatrics, it's a lot of women. And that I feel like is very inspiring to work with so many working mothers who are so intelligent, not just the doctors, but, just the whole way in the healthcare industry. And I really like that. And we're all just trying to figure out how to help other families and their children. So that's really a cool part.
We have a young daughter, and I feel like that's, for many people, really when they start to use healthcare and need navigation, because especially in the early years, you just encounter so many things that are new and that you have no way of figuring out. And then your port of call, your anchor becomes your pediatrician in some respect, right? So I think that's even more powerful in some respects, and really cool that how you guys are doing that. So take us office number 1. And for anyone that hasn't been in New York, you guys have very memorable, nice looking offices, right? Like every office is different. They like pop out on the street in the neighborhood. But how many offices are you guys today?
So we have 51 offices today.
51. Okay, so
yeah.
That's a long way from one office. So what was that journey like?
The journey was really incredible, and kind of looking back at it, it's like, wow, 51 offices, how did we get there? But really, the first couple of years, we really just stayed with those offices. And before I joined Michelle, he had opened up 2 offices. They were pretty new. And then from there, we sort of knew that we needed to shore up the system and have some systems in place before we could expand into new offices. And that's really, I think, doing that groundwork, and being that Tribeca Pediatrics has not really acquired anything. We have one office that came on through acquisition, but aside from that, everything we do, we found the space, we built the location ourselves. We have a shop that builds all the furniture. We work with the architects. Michelle does a lot of the design stuff. But before we were able to do that, we had to kind of think about, we have a whole network of these small offices. I mean, most of our offices have maybe 2 doctors at a time. So they're like small neighborhood offices. You walk in, the front desk person, the doctors, but there's a system behind that makes that possible. So kind of establishing that and shoring that up was how we were able to open the other offices. Because once you build that foundation, you can kind of build on top of it. And sort of thinking about, we opened like the call center, which doesn't sound so innovative, but I think that was one of the things that was like, okay, we can scale. So you can have one centralized place where every office phone number goes to this one place. And that was in the basement of Tribeca. It's no longer in the basement of Tribeca. It's people working from home, and you and I were talking about that earlier. But having people be able to answer the phone, and you can control that, and you can have them, if somebody wants to go to one office and it's closed, or it's a Saturday, but that office isn't open, at least they get an answer, and then we can direct them to maybe another office that is open, or an office that's open later. As we were thinking about scaling up, putting some systems in place for inventory, that was a big thing. A lot of medical offices, I think you have this idea of like, who's doing the inventory? There's like a massive closet of stuff. There's expiration dates on everything. How is that all managed? So we standardized our inventory, and I think like it sounds like a small thing, but this really helped us scale. So we decided what every office is going to have. It's all primary care pediatrics, so everybody's doing essentially the same things. And then we have these 12-foot shelves. There's 6 12-foot shelves in every single location, and they have all the same things. They have barcodes. And once a week, the medical assistants can go in there and scan. All of that information gets pushed to our centralized office where somebody is then going to order the inventory. And that's the same with the vaccines. We're able to have we have a whole system of like the vaccines that are in use, the vaccines that are in a buffer fridge. All of that is counted, so there's a lot of accuracy. But with that, we can have a network of offices that are small, but have medical assistants or a front desk person that can go between offices for coverage. So they can show up in a different office and they know where everything is because it's essentially the same. They know that that's where they can get the emergency kit is over there, or the syringes are in this, this shelf over here. That's where the backup ones are. The in-use ones are over here. So everything is kind of set up the same way so that we can scale up. When we're looking at a new space, we know exactly how much space we need in order to open up 2 rooms. So if you have 2 rooms, you can have 1 doctor. When you have 4 rooms, you can have 2 doctors. So the idea is that we're looking at real estate, we're always going to have at least 2 doctors eventually. It's not going to start that way, but it will go to that point. Hopefully 3, but that will be a larger office. So those are the things we sort of learned along the way as we got to the 51 locations. But that was, if we can make the same exam room beds and we know the dimensions of a room, then we can start looking at other spaces and figure out, how can this space be workable? Is it centrally located? Is it easy for patients to get here? And that's always been kind of something important for us.
How big were you guys? How many locations was it when you implemented a call center?
That might have been five locations. So before that, the people at the front desk were answering the calls. You don't really have a system of monitoring what's going on, and somebody's at lunch and the call is not answered. This was probably, 15 years ago. The idea of let's open this call center, let's have a couple of people that are good at answering the phone sit down here in the basement of Tribeca, which by the way is where my desk was too. And they were answering the calls, but we knew we could standardize that. So that was like, those people are going to answer the calls. They're all going to go there. So from there, that was sort of where we could then open these other offices, and we can make sure that like the front desk people are just really nice and they can focus on the patients in front of them. They don't have to necessarily know how to, work the phones.
So that's interesting. Did you put the systems in place first? Was there like a point of you reached 5 offices and you said, we need the call center, we need to centralize inventory in order to grow? Or was that sort of an evolution, right? At 5 locations, you say, gosh, we need to do calls. And then maybe 6 locations say, gosh, we need to figure out inventory. And that sort of, it gradually comes along the way. Like was there an inflection point, like a clear one, or was that more of a gradual evolution?
It was probably the call center first. And then the inventory was more of a reaction to we're running out of things. We ran out of things over there. We ran out of things over here. Like, how could you run out of that? That's crazy. This is a medical office. How could you be out of Band-Aids? And then it's like, oh, well, so-and-so didn't order them. And then but this office has 25 boxes and this one has 2. Like if there's no system in place for that, then you're only as strong as that, the person who did inventory on that day. And how can you have a practice function like that? So I think that the inventory was more of a reaction to like mistakes of kind of, not having things and running out of things and just having to, run around and bring them. And that's really where it was like, okay, we need a system here. And that was probably it. Yeah, like 5 or 6. I think when we first started, when I started at Tribeca, Michelle had the Williamsburg office and the Borum Hill office, which he had actually opened with another person, and then Tribeca. From there, we opened Park Slope, which was, like there's so many families over there. They called it like
busy
Park
office.
Stroller.
Yeah.
Yeah, it's like, there's so many kids. So the Park Slope office was really exciting. And then, it's really cool because we would open offices. We had a doctor that lived in Park Slope, which is one of my close friends, TJ Gold, and she lived there and was like, we should have an office here. And was like, yeah, we should. Let's look for it. Okay, we'll open an office there. Another doctor, Karen Mueller, who's a pediatrician in Bay Ridge, she lived in Bay Ridge. We didn't have a Bay Ridge office. And she was like, this would be a great office. Like, I would love to be here. So again, like just having these doctors that live in neighborhoods that they live there and they're the pediatrician, like, it's just like such a lovely concept. And they're just so happy to be taking care of the kids in their neighborhood, and the families are really happy with it. So a lot of the offices sort of open that way.
That's so interesting that you say that, because I was at a dinner with a few like COOs of medical practices last week, and one of the topics that was top of mind for many people was also physician burnout, like in today's age, right? And like in some respect, if you're building small offices and you can essentially build an office around wherever, it makes sense, but also your providers are, right? Like, talk about that as an investment in terms of, investing into the provider. I mean, and I'm sure that they feel appreciated and not being able to not only see kids in their community, but also to just be in their community, right?
You can run home at lunchtime,
Exactly.
grab
I mean,
something.
that kids themselves, right? And like, that is huge. I'm curious with your system of building out these offices, and you said, all the measurements, you make your own furniture. Is that like a cut and paste process now? Like, how long does it take you to set up an office if you apply your system now versus when you guys were, at 5 locations?
I mean, it's such a good question. So I remember the Park Slope office. We used to do this thing where the offices were not ready at all, and then we were supposed to open the next day. And like, I was there, on a Sunday with Michelle and his guys, and my husband was there, and we're all just like, okay, we got to get this ready, and everybody has tools, and we're like, it was a nightmare. And we did that a whole bunch of times. It was almost like, if you get down to the wire, you get everybody there, we're going to just like, we got to get this thing open. And really for no reason, because the first day there's like only a couple patients. But it would just like, the pressure somehow made you have to get it together. So we don't have that anymore. I usually am not there. I'm never there doing construction anymore, thank God. But we are able to say, okay, the office, this is the deadline. We need it open by this date. And then they work into it, work with, permits. We have an architect, but we work a lot with that person. And that Michelle is very involved in. He's amazing with space. Like, he can look at a space, you're like, there's no way this could be an office. He has an amazing vision. So that was kind of one of the most inspiring things about Michelle. You look at something and be like, we can fit 4 rooms here, and we can move this thing over, and at the end it turns into a really nice space. But a lot of the stuff they make is prefabbed, and they can put it, kind of put it together there. So we make the panels in the rooms, and the exam room beds, all that stuff is prefabricated, and we bring it in. And then we just sort of know, okay, this is going to be a 2-provider office from the start. We need to have, 4 rooms set up. A room is 7 by 8, has the pocket doors. We have like little fun things in it for the kids. But yeah, we have that, all of that stuff has now comes together much easier than it did in the beginning.
So, you kind of got to a question that I was quite fascinating is, what else about what I would call like the operating model evolved going from 5 to 51 locations, right? And I'm more talking about how you now help run the organization. How do you make decisions? How do you communicate with employees, right? Like, you're going from this point, I used to know everyone by name, and like at some point that stops, right? Can you tell me a little bit about that aspect? How do you start to think differently about running an organization once it gets out of the, immediate tangible realm?
Yeah, I think that's one of the things that sort of becomes the biggest challenge too. When I used to be able to walk in an office, I knew everyone. I walk in now and people don't really know who I am, which is, fine for my ego, but it did kind of lose some of that sort of personal. I know all the doctors and nurse practitioners, those guys, but some of the support staff I don't know. So I think one of the points where we got, so we go to 5 offices, and I'm making the schedule for everyone, and I know who everyone is, and we're handling the benefits, all that stuff. And then just kind of starting to build out, all right, now we need an HR person that's not going to work 1 day a week. They're going to work a full-time HR person. To now we have an HR department. And remember, at one point we had, okay, we're going to have a front desk manager. and that person's going to manage all the front desk people and then one medical assistant manager. But when you have 51 locations, you can't have one, so now we have regional managers. So one thing with Tribeca, we don't have managers on site all the time. We have a regional manager who has a collection of about maybe 7 offices. So they go around to those offices. They're available, do a lot of things remotely, but they're available by phone to their support staff. So those guys are able to really kind of focus on their region, their support staff, the needs for the region. What are we focusing on at this point? What are we training on? So that having relationships with those regional managers and making sure that all of them have been at Tribeca for a very long time. So all of them have actually come up through Tribeca. They all understand how we started and the mission and really just the idea. We're really focused on trying to make people feel welcome and really taking care of families and kids. So the idea is really that they can have that sort of culture and spirit when they're overseeing their support staff and training and all that good stuff.
Yeah. And I bet that changed your role too, right?
Yeah.
You're no longer doing everything. You now have to empower people to do all the things that you used to do.
Yes. Yeah. I mean, I have a pretty high standard of the way I like things to look and the way I think people should treat other people. So I meet with them a lot and just making sure that is, and their managers also, just making sure they have that same vision that I do. But it did change that a lot. We used to have, I was thinking about this the other day. We used to have like in the morning, 51 locations. We have hundreds of people working in a day, and people were sick. They call out. We're in healthcare, so people do get sick, of course. So they would call out, and we had different managers would handle the call outs. But now you have hundreds of people. So we have a call out line. So from 6:30 to 7, if you're sick, you can call the call out line. And I think that was one of the best things we ever put into place, because the doctors would call me when they had to call out, and it was like on Christmas Eve and that kind of stuff. So that's been scaling up and growing and putting those things in place has been great, and been able to focus on the bigger picture and not just being in the weeds of running the organization, but still having a lot of reporting on what's going on. Okay, these are all the people that called out today, and here's all the moves that we made. This person's covering here, this person's covering there. So it's almost like the shoemakers elves. They work at night, and then you get in the morning, and all the shoes are made. So it's similar to that you get in, and maybe there's a different medical assistant there. That person just got rerouted from another office, and we pulled somebody else. But we want to make sure to not disrupt as much as we possibly can the day of a patient being scheduled in an office. So that a lot of that stuff kind of goes on behind the scenes.
Someone else on the show was saying that, if you show up and everything runs smoothly in your visits, they feel like they've done their job. And, sometimes if a patient has no idea what, that this medical assistant was, moved around in the middle of the night to show up, like that's good. That's the mark of success. How do you scale decision-making from, to where you are now, right? As you're not in terms of, how do you guys make decisions and how did you think about delegating that, right? Because I'm sure that evolved naturally as well, right?
Yeah, I mean, I think in terms of decisions and, just in terms of, staff management or hiring or how are we going to do things, I have a really great team that I work with that have been here for a long time also. People I really trust, people that, we have a problem, we can sit down together and kind of figure out, okay, this is the issue at hand. And knowing that the decisions that they're going to make, they're based on data. We can pull a lot of data out. So we're really big on how much can we pull data out of the system and look at, utilization in a certain time or those kind of things. If we're going to close something early or we're going to, move somebody around, that sort of thing. So I think it's just having the trust in those people and really just having a strong team that you can trust. And we meet a lot. So there's a lot of recurring sort of.
Would you say that there were phases of growth? Like, in other words, at 5 locations, you started to centralize calls, right? And then like inventory and so on follow. And then you talk about something else that's really important, which is at some point you need data as well. And like I was talking to someone else and they said, there's a difference from 1 to 5 and there's a difference from 5 to 20, right? And kind of after 20 feels more or less the same. How do you view that?
Yeah, I agree with that. I mean, it's like getting to this sort of point where right now from like 20 to 50, it does feel like a lot more. You know, you can feel it. You feel like the problem sort of, it's like, is everybody unhappy right now? Oh no, there's just a lot more offices. So there are a lot more problems, and the problems sort of, compound, and you kind of have to figure out, okay, let's figure out this seems to be a recurring issue. How are we going to fix it? But that's sort of where we're at now. So we do a lot with like patient feedback, where after each visit, Steve built out, you get a text message, and we get a lot of data from that, where somebody can tell us how their medical assistant was, how their front desk person was, how the provider was, essentially how the visit is. And we get that information comes depending on what the rating is and what the comment is, goes to different managers. So that's something where we're watching, like, at a higher scale, and there's more offices, you see more feedback, but are things worse? Like, no, there's just a higher volume. And that's really where we have to kind of figure out, okay, when we need somebody to handle this, or we need somebody, we might need more help in this department to just kind of, address some of these concerns, or is it a bigger concern where we need to actually fix something?
Yeah. At what point did data become really important?
I think data has been important to us, from the beginning. I would say after maybe 6 or 7 offices, having a really strong system in place, because we're pretty small at the top of the organization. There's not a lot. We don't have, like I said, we don't have a manager at each office. They're all managed. Everything is managed centrally here. And the only way to do that is by having the data. How many visits do we have in this office? How much staff do they need? How many people do we need in the call center? How many calls are we getting? Well, if each person can answer X amount of calls an hour, then we need this amount of people. What is our SLA for the call center? We want to answer, 90% of the calls within a minute and a half, and we get this amount of calls. How many people do we need? So I think the success of Tribeca to make these little offices work is really about being scrappy and seeing with the data where we need to grow, where we can staff up, and, looking at like the billing department, what is the issue with claims? It's pediatrics. So the claims are all small dollar amounts. It's just a lot. It's a high volume of small dollar amount claims. So that's another thing with data, and pulling all the data out and just kind of seeing where we're having an issue with insurance payers, or, that kind of thing. So we're able to manage that with less people because we can sort of look at the data.
Yeah, and this is a question I normally ask later on, but I feel like it slots in very well here, which is like, what are sort of the main KPIs that you look at on over a quarter-to-quarter basis to help you understand if things are going in the right direction?
We're looking at growth for new offices. So because we have opened a lot of offices in 2023, we opened 12 offices. So that was like the biggest growth year. And how are those offices growing? Is it stagnated? Are they going up? Are there a lot of newborns, or are there a lot of transfer patients? How easy is it for people to transfer into the practice? We're looking at, that. We're also looking at offices essentially that are existent. Are they busy? Are they being well utilized? What's going on? Is there a problem in an office where people aren't happy with the service there? Is that why they're not going there? Or people, during the pandemic, there was a lot of kind of moving around. People moved out of Manhattan. So we saw offices in Manhattan, sort of the volume going down, and offices potentially in Brooklyn and Queens, there were a lot more, families out there, people moving around. So that's something we're looking at a lot. In terms of like the billing department, we're always looking at, those metrics, because if you miss something, you could miss, somebody could stop paying and then, an administration fee, a small fee, and that, that's our bread and butter, and it's like a $5 fee, but it's so many times over that if something is denied there, you have a problem. And that's where it's like, okay, we're really on top of the billing stuff, especially right now.
Yes, that is the perennial topic. And, specifically there, but generally as you're growing, we talked a lot about centralization and sort of stages of growth. How does outsourcing things factor into this, right? And how have you guys thought about it? What have you tried? What worked? What didn't? What does it make sense for? What does it not, right? What's been your framework and your approach and successes or failures in doing that?
Yeah, so outsourcing is something, so we tried outsourcing. We have a couple of different areas where we've outsourced. So we outsource some of the billing department where we have people that are following up on claims. So they're following up on claims, they're getting claim statuses. We work pretty closely with those people. So we have, I myself am in meetings with them at least 3 times a week on a high level. What's going on with those claims? Are things going off the rails? But you really, for us, we've never been able to fully just give something over and say, hopefully the money rolls in. So we have our own billing department here, billing managers, higher level billing managers who are able to see what's going on there. We also have anything that's patient facing, we have not outsourced. I mean, those people work for us. We tried with the call center, and I think in retrospect, if we would have maybe vetted it better or something, it could have potentially worked out. But it was during, I think, 2021, where basically nobody wanted to work, and then we started having patients coming back. So we had this huge uptick of phone calls, and we needed to quickly staff up call center. And so we outsourced to a company in the Dominican Republic for answering calls. And we trained them. We sent somebody there to train them. We knew exactly who each of them were. We really did an investment in this, and it just didn't work for us. I think really quickly our patients started to complain. And I mean, when our patients complain, there are mommy groups somebody puts a complaint on a mommy group, and it's it spreads like crazy. So they were really upset. The agents could speak English, but they didn't. It was words that they said that it was very obvious to people that they were English wasn't their first language, and things were getting confusing. They didn't know. Essentially, one was they would say they want a virtual. Somebody would say they want a virtual visit or telemed, and they didn't realize telemed meant virtual visit. It was kind of a translation thing. So we had to we backed off of that outsourcing part and then just hire the people we're hiring now, at least for the call center. They're all our employees. So we train them. They work remotely, but they're trained here. They work for us. They get a paycheck from us. We give them their KPIs weekly. They have a little report card. One area, the billing department works for the outsourcing. Another area we outsourced on, which ended up working out pretty well, is the overnight call service. So our doctors were on call until about 2023 when we took them off of call. So our call center opens at 7 a.m. and it stops at 10 p.m. every day. After 10 p.m., if a patient calls, it goes over to a nursing service. So the nursing service is going to triage the call. They're going to either get the patient straight to a medical professional to triage the call over the phone, or they're, depending on what it is, they have parameters. We get reports from them every night of who called, and then we're able to follow up with them in the morning. And because of that service, we were able to take our doctors off of being on call overnight and give them that quality of life back. And I think that really helped for the doctors. They appreciated it. And I don't think we lost anything in the service. Parents who call overnight, they get somebody who's awake and ready to take the call, ready to help them. They're able to get back to them right away. And then we started kind of monitoring. Of course, we were monitoring that the whole time, but there was a lot of satisfaction from the parents too. So that helped.
So what's generally the framework for deciding hey, we want to stop doing this in-house, right? So I think, for call center at some point it's a capacity constraint, right? How are you viewing this for billing or, with your overnight call service? What sort of saying, gosh, okay, we want to like now have someone else like handle a portion of this?
I think for billing, it was really like we need to scale up and scale up quicker. And if we have a billing project, that's going to be something where, okay, we need somebody to follow up on like 600 claims, and having someone in-house manage people that are doing that, it was easier for us to say, okay, we have a service. We're going to manage the people who manage that service and make sure that we could scale up if we need to. They can get more people, or if we need less, and we're paying by that. We have less employees like actually doing the billing, and they're doing kind of the in-house people are doing more higher level, where they're auditing.
Yeah, no, and I think that's something that generally is how people like really try to de-risk it too. It's never a whole source, move everything out, but sort of take the easy stuff and have someone else manage and supervise it, right? I think someone else here on the show was saying the same thing, that like you should always make sure you also can hold the vendor accountable on things, right? And I think that is a really interesting point. How over the years you've worked with lots of providers, and some relationships that worked out well, some that didn't. How do great vendors or vendor partners stand out to you? Like what have you seen be like a leading success practice that impressed you over the years?
I would say like how sort of malleable they are to be able to work with us and our needs. The brand is very strong for us because we grew organically. We opened these practices. The look of the practice and the feel of the practice is very, very important to us. So if somebody's able to customize, if we're able to customize what a vendor is offering and really put our mark on it, it feels like Tribeca Pediatrics. That's really important to us. And then, just vendors that are, able to grow with us. As we made our own portal. So Steve Schwartzberg, and he came up with a portal. And, it was really out of a need to have something that was completely customizable. So it looks great. It's built on a Salesforce platform, but each time we need to work with another vendor to potentially add a service on, it's like it needs to fit our needs kind of exactly. And we need to know that we can continue to change it and modify it based on what we need. Because I think another reason we're able to be so successful is we can pivot pretty quickly. When there's a measles outbreak, we can then put triaging questions onto the portal and then train all of our call center people on how to triage calls when they come in, what to look for in a chart to see if somebody, depending on the age of a patient, they might not be fully vaccinated, whatever the case is there, and then be able to triage that person accordingly. But all of that is built on whether or not we customize the software we have. So if it's out of the box, we probably can't do anything.
Yeah.
And then we're not able to pivot so fast.
Yeah, and I think that's in many of those things, it's like once the vendor is no longer selling a widget, that you are no longer buying off the shelf, right? Like it truly needs to fit in. And I think it's weird. Some people are much better at this than others. All right, so we are coming near to the end. Time flies. I mean, I gotta say, I think it's so cool and fascinating always to learn about like the journey of all of these different practices. Again, for anyone that hasn't been in New York, if you walk the streets of New York, you will Tribeca Pediatrics, and you know what Leslie's referring to from the brand and the look, and sort of even to someone I knew of the practice well before I ever had kids, just because it's like very recognizable, right? And I think that's kudos to all that you guys have built, starting with the offices themselves. All right, so I think the next 6 questions are more like we asked them to everyone, and we just these are more like rapid fire. So, what is one of your greatest successes in solving a healthcare operations problem? Right.
I was thinking about this. So something recently we were, there's a mental health crisis in the United States. It's very hard to find mental health care for patients. We're in primary care, so that, we see a lot of patients. Something we did that I think is very cool and has been very successful for us. We give, starting at 12 years old, patients get a survey, and it sort of screens them for different underlying issues that might come up, and then the pediatrician can have a conversation with the patient. So if anything comes up on those surveys and the pediatrician wants that patient to potentially have a referral to mental health, we created our own in-house mental health team with our doctors. So there's about 3 doctors that got additional training through this program in New York. It's called Project Teach. So it's for primary care providers, and they got additional training. So we were able to say, okay, this patient might need something additional, but maybe we can't offer it at that time. So what we're doing is, depending on what the issue is, we can then refer them to one of our in-house pediatricians who is on the mental health team. We have our referral specialist coordinates that. It's a virtual visit. And from there, that person can spend a little bit more time, go over some surveys, and then they can either help treat the patient, depending on what the issues are, or we're working with different mental health providers. For us, it's really important that we have providers that take insurance. Is people, that not everybody has $300 an hour for mental health. So we're able to sort of then help transition that patient onto a mental health provider that either takes insurance, or we can handle, the management of that patient in-house. So that's been really great to see the success of that and just the amount of patients we're able to take care of.
That's incredible. And it talks about you can do cool, once you get to a certain scale, now you have the power of the platform, right? And I think that is a really cool story. Well, this is a good one. In 2 sentences or less, how do you describe your job to people outside of the industry?
Yeah, that's a good one. Usually if I start talking too much about what I do, people seem like they're not interested. I usually say I manage a bunch of pediatric offices. And
yeah, that's
what it is. If they know what Tribeca Pediatrics is, then they're like, oh, okay, well, which one are you at? And I'm like, all of them. And then they usually say, oh, do you know that they have one in Astoria or something? And I'm like, yes. Of course I know that.
I was there late night on a Sunday opening it.
Exactly.
For other operators in healthcare, what's one thing everyone should pay attention to in the next year?
So I was thinking about this. I think one thing that's pretty interesting right now, at least in primary care, we're seeing a lot of things kind of going to patients' deductibles or coinsurance that have not been going there before. And I think more is being put on patient responsibility, and how that sort of affects some healthcare operator, thinking about, okay, can we do a rapid, test or some kind of testing technology? How much does that cost? And of course, working with a clinical team, your clinicians on this to make the decisions, but also having the understanding that, okay, we can find the result on, let's say, a flu test. You get the result right away, but is it going to cost the patient $75 to find out they have the flu? Like, is that like weighing those sort of things and having an understanding from an operator's perspective of like, this is going to cost this much money. Is it worth it? And bringing that information to your clinical team to make those decisions, because the way that our healthcare system functions, the patient doesn't necessarily get that choice, and we might not even know it's going to their deductible, but it could be very expensive for them.
Yeah, that is the holy grail of healthcare. Lots of things that would be great, and then you want to make sure that it's not racking up a big bill on the back end. What's your favorite healthcare statistic?
So I would say 95% of children are covered by insurance in the United States, which is really great, because of Child Health Plus and some of the programs in place. And it just really shows that we can do great things for people when we have the programs in place, and kids can get, primary care visits and really take care of them. Maybe
that is so important. And ideally, we will get to 100%.
Yes.
On points, right?
Yeah.
Well, awesome. One final question. Just generally, nowadays, what does your week look like? What are some of the meetings? Generally, what's like the cadence of your meetings, right? I'm curious, like day in the life.
Sure. So I meet a lot with my teams, the teams that are sort of managing on the ground, meeting with HR teams. We usually meet 3 times a week. For our community outreach team, those guys are focusing on each of the offices, the new offices and locations that are growing, how we can, work on maybe working with a birthing class or OBGYNs in a neighborhood or something, working with, whatever projects we're working on right now, working on rolling out provider messaging. That's something Steve and Jess are working on in our portals is a really big thing. Kind of how do we want that to look? Because of course we're creating these things. So that's a meeting. Steve then goes back and does his work with the developer on programming that, but just ensuring that those things are going, then testing it. We have a lot of ad hoc meetings that come up depending on what issues are going on. But yeah, it's great too because people work from home now. I come to the office. I like going to the office, but depending on what day it is, there are different people in the office. So, each day is a little bit different, trying to get together with those people that are here, whether it's like the schedule team, looking at all the different offices, thinking about provider schedules, that kind of stuff. But yeah, that's a typical week.
That's great. Lots of different flavors. And then an odd podcast interview.
Yeah, and a podcast.
Yeah. Hey, look, I think we've reached the end of this. This was incredible. So
this was fun.
You. It was really cool. I think it's so fascinating to hear how different organizations sort of manage their journey, and it just increased my admiration for what you guys have built. It's too bad you're not in LA anymore, but
thank you. I know, I miss LA.
Yeah. But hey, I really appreciate it, and thanks again for the time. And
Thanks,
this was great.
Yeah, thank you. Okay, looking forward to hearing it. Have a great day.